Last night, I did a webinar to over 100 people. Our webinar room can only hold 100 people. We maxed it out. That's the third time that we've maxed out the webinar room. We're going to have to dial in another webinar server in order to accommodate our growing fan base, our growing audience all around the world. Last night on the webinar, we had people from South Korea, from Portugal, from Australia, from the United Kingdom, from Canada, from the United States. It was awesome. 100 people told. And I was speaking about, I gave a 50-minute presentation about how to optimize the absorption of your nutritional supplements, how to optimize the absorption of your nutritional supplements, because that's the whole deal here, right? We're attempting to fill your body's nutritional tank up because your body knows how to fix itself. Your body wants to fix itself. This is the naturopathic foundation principle. It's referred to as vis medicatrix naturae, vis medicatrix naturae, the inborn natural ability of the human body to fix itself. And this is something that people get confused about all of the time, because the average person on the street, if they have any inkling at all about what naturopathic medicine is, they will tell you, it just rolls off the tongue, well, those naturopathic doctors, they're just interested in giving natural medicine. Well, what the heck does that mean? What's a natural medicine? Every single homeopathic medicine ever made is not found in nature. They are manufactured by human beings from things that show up in nature. Herbal medicines, herbal tinctures are not found in nature. The herb is, but we have to manipulate the herb into a medicine, right? It's not exactly natural. This is not what we do. We do not deliver natural therapeutics, whatever that means. I'm still trying to figure out what that means. What we do, however, is support and promote the human body's natural ability to fix itself. We support and promote the built-in God-given ability of the human body to fix itself, and this is where the term came from, naturopathic. And, you know, this is a beautiful thing to do. This is a wonderful thing to do, and quite frankly, most people thought that this was what their MDs did. You know, most people think that MDs are in charge of health care. MDs are not in charge of health care. MDs do not practice health care. MDs practice disease management. And MDs are not trained in how to make the body healthier. MDs are not trained in how to get to the root cause of whatever it is that's at the bottom of your illness. MDs are trained in how to deliver drugs and surgery in order to suppress and manage the symptoms of the illness. MDs can't even cure heartburn. They can manage it with a little purple pill. They can't cure arthritis or high blood pressure. They certainly can't cure degenerative disc disease or osteoarthritis of the knee, but they can give you 1 fake knee, 2 fake knee, 3 fake knee, 4. They can do that, and they often do, and they don't give you a refund when the first one, the second one, the third one fails, do they? No. This is a very interesting proposition to people, and to most people, when they understand this simple, basic concept, it is a eureka moment for them. Your medical doctor, you know, they might be really nice people. This is not a personal criticism. This is a professional fact. Allopathic medicine. The training of an allopathic physician argues that the human body is a machine made of parts. It's a biochemical soup, which was a random conflagration of evolutionary fiat that happened thousands of years ago in some antediluvian swamp somewhere. And then the human body grew and evolved over time, and the human body doesn't have the ability to fix itself. And that once you're sick, you're screwed. Once you're sick, you're screwed is the MD's mantra. Now, that's good for the pharmaceutical companies, isn't it? Because it doesn't take a rocket scientist to figure out that it profits the drug companies more to manage the illness than it does to fix the illness. Right? I mean, they make more money by managing it than they do by fixing it. If they fix it, you don't have to keep taking your drugs. If they fix it, you don't need that 4th knee surgery. If they fix it, they've fixed it, and you're gone from their office. It's remarkable to me that we have given so much social cachet that we have given so much prominence and so much respect to people with MD after their name. We have. It's a cultural phenomenon. You know, it started with Marcus Welby and the MASH and Dr. Kildare and that show that George Clooney was on, right? And it's kind of snowballed into this overarching social obeisance that most people in North America suffer from. We all genuflect automatically at the altar of the MD without question, because we think that our MD knows what's best for us. We think that our MD has their hands on the safest, most effective, most affordable therapeutics available to humankind. But they don't, as is evidenced by the fact that under their tutelage, under their care, quote unquote, our health has gotten worse. Our life expectancy has gotten worse. Alzheimer's is skyrocketing. Autism is skyrocketing. Birth defects are skyrocketing. Type 2 diabetes. I mean, don't even get me started about type 2 diabetes. It is crazy how bad it's getting. And yet, we keep going back to the same dry well. I mean, you do. You continue to pay your medical doctor, your medical insurance premiums every month. You do that. You do your medical insurance premiums every month, and what does that give you? That gives you access at some time in the future to the system of medicine that's not only the most ineffective system of medical treatment on the planet, but it's also the leading cause of death. 780,000 people a year killed by MD therapeutics. 780,000 people a year killed by MD therapeutics, and we keep going back to that same river. We keep going back to that same well. We keep going back to that same garden. We're eating the rotten fruit, and we wonder why we're dropping like flies. Because your MD does in fact not know what's best for you. Your MD does not know what's best for you. Your MD does not have their hands on the most current, safest, most effective, most affordable therapeutics available to humankind. They do not. They only know what they've been trained in: drugs and surgery, drugs and surgery, drugs and surgery, not meant to support the body's ability to fix itself, but meant to manage and suppress your symptoms. Most people are smarter than MDs. They have much more common sense. I mean, for goodness sake, if there was mold in your house, there's mold in your house. Let's say that you have a basement and, there was a flood and there's water in your basement, and now a month later you've got mold growing in your basement. Well, most people would look to get to the source of what the mold was, find out how the water got in the basement in the first place, and fix it so that water doesn't keep getting into the basement. So, you call up that company that lines the basement. I forget their name, right? Or you put in a good drainage system around the house so water doesn't get in the first place. That's what most people would do. However, if it was an MD that owned that house, what they would do, or, if you hired an MD, mold elimination company, to come over, they'd just spray the hell out of the basement with, chemicals to kill the mold. They would do absolutely nothing to prevent it from coming back. They would do absolutely nothing to prevent it from coming back. They'd spray the hell out of the mold that they could see, and then they'd paint over the rest, keeping their fingers crossed. And this is insanity. This is insanity. We've given the children the keys to the kingdom, and they've, the keys to the car, and they've driven it over a cliff. It's in a ditch, upside down, in a swamp. And, we wonder why we have a problem, because we've taken the wrong dog to the hunt. We've given the wrong medical profession all of the legal responsibility, all of the legal power, all of the political power. I'm a licensed naturopathic physician, did 4 years of pre-med. The University of Massachusetts in Amherst did 4 years of naturopathic medical school at Bastyr University in Seattle, Washington. Completed 900 hours of clinical supervision, passed all of my courses, graduated with flying colors, took national boards, passed them, took state boards, passed them, and have been licensed to practice naturopathic medicine for the better part of 2 decades. However, in the great city of Chicago, and Boston, and Miami, and Atlanta, and you name it, the list goes on and on, it's illegal for me to practice medicine. Can't do it. In Seattle, I can deliver babies, perform minor surgery, prescribe drugs. How about that? You know, you can prescribe drugs holistically. Did you know that? You can. I can call myself a physician in Seattle. I can order any diagnostic test I want, work in hospitals, and it's all paid for by insurance. However, if I even call myself a doctor in the great state of Illinois, I'm fined $5,000, which I was. The great state of Illinois, the Department of Professional Regulation fined me $5,000 because I used the word doctor on my website. And, you know, we're okay with this? Listen, I'm not okay with this. You shouldn't be okay with this either. I've said it a million times. I'll say it again. If you're not angry, you're simply not paying attention. There is a better way. That's why we're here.